what would you say when a patient says, I want to sleep because it's less invasive?
It's not. So this is, and again, people go, oh, you're a sleeve surgeon hater. Sleeve surgeons tell patients the gastric bypass is much more invasive, much more complicated, much riskier. Break it down. It is not much more invasive. So the same number of cuts, the same number of pain, the same disability, the same recovery. Much more complicated, yes, technically, for the surgeon, but that doesn't matter to you. Much riskier, not true, false. When you look at the big studies, and these are done, prospective randomized studies looking at sleeve versus gastric bypass, the percentage of complications are identical. In other words, the leak rate is in the same statistical percentage. One might be 1.9 and the other one 1.7, but statistically speaking, that's the same number. It's called within the range. So when you look at bleeding, infection, leak, death, all statistically identical. The number's not identical, but the statistical analysis showed there is no statistical difference, no statistical advantage to either one. I cannot tell you the gastric is safer than the sleeve. It isn't. It's the same. No one who tells you the sleeve is safer than the gastric is telling you the truth. It's the same. Now, a particular surgeon may not be lying to you if they say the sleeve is much safer. If what they mean is the sleeve is much safer when I do it, because when I do a gastric bypass, I have a high complication rate. Yes, but intrinsic to the operation, surgeons that do a lot of gastric bypass have the same complication as surgeons who do a lot of sleeves. It's about expertise. So when you look at big national studies, the complication rates are statistically the same. So when they say less risky, not true. Less invasive, not true. Higher complications, not true. More technically difficult, true. But that's the job of the surgeon. The gastric requires a lot more technical ability than the sleeve, which is why a lot of sleeve surgeons say, I'm not going to do a gastric, I'm not even going to bother to learn. True bariatric surgeons do both, and there are some very good true bariatric surgeons in South Florida.